If you're a swimmer, in order to avoid shoulder injuries, it's important that you have good shoulder blade or scapular control. My name is Dr. Robin Armstrong. I'm a chiropractor and swimmer from Willowbrook Chiropractic in Langley. And today I'm going to show you 4 exercises you can do to gain some scapular mobility, some scapular control, and strength. First, we're going to start on all fours. So we're going to do a variation of cat-cow, but with our hands close together, palms touching. So we're going to set up knees underneath our hips, arms underneath our shoulders, but close together, so in the middle of the mat. We're going to alternate arching and rounding. So I want you to lead with your head, because that gets us into our thoracic spine, our upper back, a little bit more. So we're going to look up, arch the spine, drop the ribs, arch the low back, then reverse it. Tuck the chin, press between the shoulder blades, lift the heart, lift the belly, and then reverse it, looking up, arching, and rounding. Going back and forth like this 5 to 10 times to warm up the spine and get some mobility in the middle back. Next, we're going to strengthen one of the muscles that controls the shoulder blade, called serratus anterior. So it helps protract the shoulder blade. So our shoulder blade either goes forward, arm reaching forward like that, or retracts, squeezing back. So we want to work on the protraction part. We're going to do a variation on a push-up. Elbow is going to stay straight. We're going to try to keep the middle back still. So come to all fours again. Palms underneath our shoulders. And we're going to press into the mat and then let the chest sink down. But really what's happening is the arm is pressing, protracting, and then the shoulder blade is squeezing, retracting. Try to keep the upper trapezius relaxed. Try to keep the middle back still. Protract, retract. Protract, retract. When you feel like you have the feeling of it, you can add a little bit of a challenge. So moving into more of a push-up position. So long spine, same movement. Protract, retract. Protract, retract. See if you can imagine the shoulder blades wrapping around the chest, then squeezing together. Do that about 10 times. Next, we're going to do that motion, but add in a twist. So I'm going to show you seated first, but then we're going to go down to the floor. So what we want to do is we're going to protract, retract. I'm going to open my arms just to 90 degrees, and that's as far as the arm is going to move. From there, I'm going to twist open with the upper back, but we're really trying to target the twist in the thoracic spine, the upper back. So I'm not reaching back with my arm to compensate for any lack of twisting in my upper back. Okay. So let's come to lying on your side. You can use your other arm for support, or I've got a little pillow here for myself to make it a bit more comfortable. So lying on your side, if both arms are available, out in front of you like this, palms stacked, hips stacked on top of each other. To start, I'm going to protract, reach the arm forward, retract, squeeze the shoulder blade, upper trapezius relaxed, open up to the ceiling, stopping at 90 degrees, and then I'm going to twist open with my upper back. My hips stay stacked. And then come back to center, lower the hand, protract, retract, open, hips still, twist open. See if you can twist a little further each time. I'm going to show you from behind as well. Lying on my side, arm either supporting my head or extended out to the side. Palms touching each other, hips stacked. I'm going to reach my top hand forward, protraction. Pull my right shoulder blade back, retraction, keep it retracted. Open the arm up to the ceiling. My head can just follow where my hand goes. Then I twist open with my upper back. My hips stay still. Come back to center, lower the arm. You can repeat that 5 to 10 times on each side. Next, we're going to work on some of the other muscles that control the shoulder blade or attach into the shoulder blade, namely the middle and lower trapezius. So we're very familiar with the upper trapezius, our shrugging muscle, but the trapezius itself is actually one big diamond-shaped muscle from the back of the skull to the tips of the shoulders, down into almost the lower back. And the middle fibers squeeze the shoulder blades together. The lower fibers pull the shoulder blades down. So we want to work on strengthening those because often the upper trapezius are overactive. So we're going to do this by doing first a T-shaped motion and then a W-shaped motion. When we do that movement, we're thinking about squeezing the shoulder blades. So we're not moving the arms, we're squeezing, initiating that movement from the shoulder blades. So again, come to lying on your stomach. It does help to have something to support your forehead. We'll start with that T-shaped motion. So arms out into a T. You're going to lift them ever so slightly up off the ground, maybe half a foot, 5 to 10 centimeters, and then lower down. We keep the upper trapezius relaxed, and we squeeze between the shoulder blades. Hold the squeeze for about 2 to 3 seconds, and you can repeat this 10 times. Next, make that W shape with your arms. So elbows are down by your side, thumbs are pointing up towards the sky. Forehead is supported. We don't use the upper traps. We squeeze the shoulder blades together to lift our W arms up off the ground. Hold for 2 to 3 seconds, and then lower. Repeating that 5 to 10 times. So gaining this control of our shoulder blades, gaining some mobility in our upper back, that's going to help prevent shoulder injury, recover from shoulder injury, and also take our swimming to the next level. If you have any questions about anything I talked about here today, please feel free to ask myself, Dr. Robin Armstrong. I'm always happy to help.